of Indian Homeopathy, Professor Dr. Ashok Das Sir. Sir had provided us profound insights in the last session. His expertise and engaging delivery made the session both informative and inspiring. We're very grateful for your contribution, sir, and the valuable knowledge you shared with us. And I hope everyone will find today's session also as enlightening as the last was. If anyone have any follow-up questions or doubts, can freely ask after the discussion. Thank you. Over to you, sir.
Okay. Thank you to all. In my last lecture, I have discussed the different manifestations depending upon the different stages of miasms, psora, syphilis, and psychosis. Hello? Yes, sir. I have already started. Okay, well, just you see. Hello? Am I audible?
Yes, sir.
Okay.
Yes, sir.
The slide is not working. Hello?
Yes, sir.
The slides are not coming. Give to Vishal. Hello. Hello. Audible after slides is not coming. Okay, you just see you have the access. Okay. 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 Yes, yes, everyone. Hello. Am I audible?
Yes, sir. You're audible.
Go to the slides. Sorry for the disturbance. I told you that in my last class, I have discussed about the different manifestations, symptomatic manifestations, according to the different stages of the different miasms, psora, syphilis, and psychosis. Today, I am present before you the different disease manifestations of the same disease. What I want to mean that a specific disease, how its manifestations differ according to the miasms. In this regard, I have taken one very common disease which we commonly encountered during our daily clinical practice, that is bronchial asthma. Today I'll show you that how a particular disease is being manifested by different types of symptoms depending upon the miasm. So we can say psoric bronchial asthma, psychotic bronchial asthma, and syphilitic bronchial asthma. First, I would like to discuss about the psoric bronchial asthma. The psoric bronchial asthma starts in winter, often associated with a family history or past history of allergy, like allergic rhinitis, eczema, or urticaria. There may be history of food allergies. Usually, psoric bronchial asthma starts with watering from nose, sneezing, with cough, which lasts for 1 or 2 days, followed by development of dyspnea. So, psoric bronchial asthma starts with allergic manifestations and ultimately leads to dyspnea. It is associated with a dry, spasmodic cough. It may be due to the suppression of the measles or any type of skin disease. Evening aggravation suggestive of psora. Dyspnea ameliorated by lying on the back. There may be profuse frothy expectoration, which may or may not ameliorate. Dyspnea associated with sweating, which ameliorates but avoids open air. That means psoric bronchial asthma may be associated with profuse sweating during dyspnea, and that sweating ameliorates the patient, but the patient avoids open air. So these are the different characteristics of psoric bronchial asthma. Now coming to the psychotic bronchial asthma, you will not find any allergic history in the patient. It starts or aggravates in rainy weather. Dyspnea starts with cough, followed by expectoration. Psychotic cough is usually bronchial. What is bronchial cough? Bronchial cough is a symptom of bronchitis. What is bronchitis? It is the inflammation of the bronchial tubes in the lung that leads to cough. So, psychotic bronchial asthma associated with bronchitis. That the discharge and expectoration are yellow or greenish yellow, and there is profuse expectoration with asthma, which is worse during early morning. So early morning aggravation of asthma is psychotic. The psychotic asthma aggravates in humid, moist, or damp atmosphere, and during the rainy season that I already told you. And this early morning or late morning aggravation of the attack denotes psychotic asthma. The patient gets ameliorated from slow movement and lying on chest or abdomen. Very important one, that psychotic asthma relieves by slow movement, lying on chest or abdomen. Ameliorated by yellow or greenish yellow expectoration, and the patient prefers for open air. So these are all the different characteristics of psychotic bronchial asthma. As I told you, the patient compelled to move. There may be stitching pain in the chest with different types of aching pain and ameliorated by pressure. The patient may have the manifestation of stitching pain in the different parts of the body, which may be ameliorated by pressure. Asthma alternates with skin symptoms, psychotic, and hereditary bronchial asthma is generally psychotic. So if you get the history of bronchial asthma in the family, usually it is sodic. So sodic bronchial, it is psychotic. So hereditary bronchial asthma is generally psychotic. Now coming to the syphilitic bronchial asthma, no nasal allergy. Asthma starts in the summer. I told you, sodic bronchial asthma starts and aggravates in winter. Psychotic bronchial asthma starts and aggravates in rainy weather. And in contrast, syphilitic bronchial asthma starts in the summer. There may be history of syphilis in the family, and the bronchial conditions begin with dyspnea. That is very important. There may not be any history of allergy, no watering from nose, sneezing. All on a sudden, the patient develops dyspnea without any other premonitory symptoms. Aggravation, summer, warmth, midnight, sweat, lying down. All are the aggravating factors of syphilitic miasm. Dyspnea occurs before going to bed or while lying down. So please keep in mind, the patient feels dyspnea before going to bed or while lying down. There may be presence of ulcer in the respiratory passage, and sweats aggravates. The patient desires cold both externally and internally. So these all aggravating and ameliorating factors, along with different concomitants, gives us a feature of three different miasmatic bronchial asthma. In case of syphilitic bronchial asthma, there is paroxysmal cough with chest yellow, greenish, or clean, sticky, thread-like discharges. Now you see, the discharge of psychotic asthma is very characteristic. Usually, it may be tasteless, yellow, greenish, or clean, but sticky, thread-like discharge. This is very important. Sticky, thread-like discharge that denotes syphilitic asthma. The patient has barking cough. Barking cough means cough like a dog. While dog coughs, this sounds of the syphilitic asthma is like that. There is typical midnight aggravation. And that midnight aggravation may be syphilitic or the combination of psychosyphilitic state. So far I have discussed about the three types of bronchial asthma depending upon their miasmatic background. Here I have given how to differentiate. Apart from that, the sodic bronchial asthma starts with watering from nose, sneezing, cough, then dyspnea. But in case of psychosis, there is first dyspnea, then cough, followed by expectoration. Then dyspnea and cough at the same time, that denotes psychosura. Bronchial condition begin with dyspnea, that denotes syphilis. So, how the different symptoms developed? What are the different aggravation or ameliorating factors? What about the expectoration? What about the different concomitant symptoms and their aggravating and ameliorating factors? That helps you to differentiate between whether it is a sodic, syphilitic, or psychotic, or their different combinations. Now, so far I have discussed, I have given one example of bronchial asthma, but it may be in relation to any other disease. It may be rheumatoid arthritis, it may be gout, it may be diabetic mellitus, whatever may be. The different diseases differs in their manifestations depending upon their miasmatic background. So that is very, very important to understand. After this, I would like to gradually progress to the application of miasmatic theory. So far I have discussed the theoretical knowledge of miasm. Now I would like to discuss how that theoretical knowledge of miasm needs to be applied or needs to be applied in actual clinical field. That is very, very important. So from this time, I am approaching towards the practical application of our theoretical knowledge. Now, the first, whenever a patient comes to you, if he wants to treat, as you all know, first step is a thorough case-taking of the patient. Please, you need to take the history according to Hahnemannian method completely. The second step, after taking the history of the patient, you need to diagnose the disease from pathological point of view, from nosological point of view. That means from which disease the patient is suffering from. As a homeopathic physician, we should not avoid this part. In fact, a homeopathic physician should have an equal knowledge of diagnosing a disease by applying all the modern advancement in the medical science. It may be the different laboratory investigations, X-ray, ECG, CT scan, PET scan, MRI, whatever may be. We need to diagnose the disease from pathological point of view. So knowledge of disease, if you think of our organ of medicine, can be classified into knowledge of disease in general, the knowledge of disease in particular. Here, I'm talking about the knowledge of disease in general. Now, in the background of that clinical diagnosis, nosological diagnosis, or pathological diagnosis, we have to go further for individualization. That is the difference between allopathic approach and homeopathic approach. In allopathy, the physician target is to diagnose the disease, from which disease the patient is suffering from. And they have their specific medicine depending upon the diagnosis of the disease and their function ends. But as a homeopathic physician, after the confirmed diagnosis from pathological aspects or clinical aspects or nosological point of view, we need to go further to find out the individualizing features of that particular patient. How that particular patient is different from others while suffering from the same disease. And that denotes the individualization of the patient, which is the very basis of homeopathic prescriptions. So, homeopathic individualization needs to be done in the background of the nosological diagnosis. Until and unless you know what is common in that particular case, how you can differentiate what is uncommon. So, in order to find out the uncommonness of the particular case, we need to confirm diagnosis of the disease as far as practicable. This needs a lot of discussion. I've switched over to the next one, that how diagnosis helps in homeopathy. That's a big chapter to discuss. Anyhow, in the background of the diagnosis of the disease, now we'll go for analysis and evaluation of symptoms. As you know, during test taking, you will get a lot of data, and that data needs to be classified into different types of symptoms. And the different types of symptoms are not of equal value. So they needs to be evaluated according to their value, that is evaluation of the symptoms. So analysis of the symptoms denotes classifying the different types of symptoms which you gathered during test taking. Now the evaluation of the symptoms, that refers to the grading of the symptoms according to their value. In this regard, there are various methods. The most one is Dr. Kenton view, Bonniessen's view, and Bogart's view. But please keep in mind, the word evaluation of symptoms was classically explained by Dr. Kent. But if you go through the aphorism 153 of the Organon of Medicine, Hahnemann also classified and evaluated the symptoms as described in the aphorism 153, where he says the common symptoms and the characteristic symptoms. Common symptoms have least value in homeopathic prescription, but homeopathic prescription is to be based on characteristic symptoms, rare, uncommon, peculiar, striking symptoms. So, the particular French evaluation of the symptoms, although described by Dr. Kent, but if we see that Dr. Hahnemann also evaluated the symptoms, if we analyze the concept of aphorism 153. So, evaluation of the symptoms may be done according to Hahnemannian method, Kentian methods, Bonniessen's method, and Bogart's method. Now, after that, now I am switch over to directly the miasmatic diagnosis. I will describe later on in depth, but I'm just discussing the steps. So fourth step is miasmatic diagnosis. Next, the formation of totality of the symptoms from miasmatic angle. So far earlier we have discussed that we have to prescribe on totality of the symptoms, but after at last Hahnemann, when published chronic diseases, he told that not only the totality of the symptoms, but the miasm responsible behind the expression of the totality of the symptoms should also be considered. And that is the totality of the symptoms of from miasmatic angle. And the last step, the selection of medicine on the basis of the totality of the symptoms, including causative miasm. So I will discuss step 4, 5, and 6 in relation to my today's lecture, because evaluation is a big subject. Just I want to emphasize on the miasmatic diagnosis, how to form the miasmatic totality, and how to select the medicine from miasmatic aspects. Now step 4, that is miasmatic diagnosis. What to do? That you have taken the case. All types of symptoms you have collected, starting from present complaints, history of present complaints, past history, family history, personal history, homeopathic generalities, both mental and physical. Then you have to separate that out of those symptoms, and you have classified them. Now then you have to differentiate it, that these are the symptoms of psora, these are the symptoms of syphilis, these are the symptoms of psychosis. So the different symptoms of the patient should be segregated under psora, syphilis, or psychosis. Now, in a particular case, you'll see there may be only psoric symptoms, or syphilitic symptoms, or psychotic symptoms, or there may be combination of different miasms. So segregation of the different symptoms according to the miasm, that I have already discussed, that what are the symptoms of psora, what are the symptoms of syphilis, what are the psychosis. Okay? As I told you already, the review the past family history and the personal history of the patient, and diagnose the causative miasm, either single or mixed. So that is very, very important. Whatever you have gathered in your case taking, that should be analyzed on the basis of the knowledge of the different manifestations. Review the past history of the patient to understand the acquired miasmatic influence on the development of the present disease. Yes, I told you that a patient have the miasmatic background which he inherited from the parents. But the patient may acquire some miasm during his lifetime, starting from the primary manifestation to secondary manifestations. So in adult persons, the miasmatic background comes from, one is inherited component, another is acquired component. So a past history, a detailed past history of the patient will help you to know the acquired miasmatic influence in the development of the present disease. Review the family history of the patient to understand the hereditary miasmatic background. So the past history and the family history, that gives an idea about the miasmatic background of a patient. The personal history. Review the personal history of the patient to understand the accessory circumstances which influence the development of the present disease manifestations, as well as to find out the exciting or maintaining cause, if any. If I refer to the aphorism 5, 7, and others, there is a concept of accessory circumstances, which includes, I have told you earlier also, the different accessory circumstances. I don't want to discuss now, but that accessory circumstances may act as a triggering factor, that is the exciting or maintaining cause for the development of the disease. So I told you also earlier, the miasm and the accessory circumstances, the interaction between the two ultimately leads to the different clinical manifestations of the patient. So the personal history also help you to understand that accessory circumstances as well as the exciting or maintaining cause of the disease. And that is very important in the treatment, because you have to remove the maintaining and exciting cause along with miasmatic prescription. So if you just have a summary, points in favor of miasmatic diagnosis, the history of the patient, which includes the present complaints, history of present complaints, past history, personal history, realities, both mental and physical. So what may be the miasmatic diagnosis? It may be single miasm, only SORA, only psychosis, or only syphilis, or there may be SORA psychosis, SORA syphilis, and all the three. So this may be the miasmatic diagnosis. As I told you that this combination, this mixed miasm may be of two types. One may be complex or compound. What is complex? What is compound? Complex means when two or more dissimilar diseases exist in the same organism side by side without forming a real amalgamation. As you say in footnote 1 of aphorism 40, please keep in mind. When two dissimilar diseases meet together and both of them persist for a long time, they can present side by side in the same person, leading to the formation of the complex disease as described in aphorism 40. So two present simultaneously at the same time, SORA psychosis, SORA syphilis, or the combination of all the three. But there may be combination compound. When such a combination passes through hereditary, both the diseases unite with a permanent bond that they cannot be disengaged easily. You see, when this combination of miasm passed through hereditary to the next generation, then you cannot entangle or differentiate the symptoms of each miasm. They formed a new combination, which is found in case of tubercular state or pseudosoric state. In fact, this particular state nomenclature was given by Dr. J.H. Allen as a tubercular miasm. Hahnemann described only three miasms, SORA, syphilis, and psychosis. But Dr. J.H. Allen, he has given a new miasm, that is tubercular miasm, which is a combination of SORA and syphilis, but that needs to be transmitted through heredity, producing a permanent combination of SORA and syphilis, leading to the tubercular miasm or pseudosoric state or pseudo-SORA. So these are the thing of development of pseudosoric state or tubercular miasm. Now, whenever you are going to treat a patient, if the patient is only of one miasm, it is easy to prescribe. But at present, most of the chronic diseases are the combination of 3 miasms or at least 2 miasms. So, while going to treat a mixed miasmatic cases, you have to prescribe first the dominant or active miasm. So, you need to know which miasm is dominant or active now in a mixed miasmatic case. Please keep in mind that is very, very important, because you have to select a medicine on the basis of the dominant miasm. When the symptoms of the dominant miasm disappeared, the next miasm will come up and it becomes more prominent. Earlier it may be psora, the psoric symptoms has disappeared. Now the psychotic symptoms has appeared. So now the psychotic miasm is dominant or active. You have to find out the medicine which covers the present dominating miasm. So after treatment, it disappeared. It may need one prescription or may need several prescriptions at different times, depending upon the change totality of symptoms. But whenever that particular miasm has disappeared, if it is of 3 miasm, syphilitic symptoms or psychotic symptoms may again come up. Again, you have to prescribe another medicine depending upon the change dominant miasms. And at last, you have to give psoric treatment to complete the cure. So, in mixed miasmatic cases, our job becomes much more difficult. So, what is important during the management of a mixed miasmatic case? You need to recognize the dominant or active miasm. How to do that? That should be done on the basis of the secondary manifestation of the miasm and the common of diagnostic symptoms and their pathology. That means what common symptoms or diagnostic symptoms or what disease pathology is now very predominant or active, and what's their secondary manifestations of that particular symptom or miasm. That gives an idea about the dominant miasm. And at the same time, determine the latent symptoms of the dominant miasms. So you need to recognize the dominating miasm, its secondary manifestations, and the symptoms of latent miasm. So now we have already done it. You have to know it has to be, now the step 5, you need to form the totality of the symptoms from miasmatic angle. You have identified the different symptoms, the dominant miasm. Then you have to form the totality of the symptoms. Cases in which the single miasm is the cause. Yes, here only you have to think of the totality of the symptoms and the causative miasm, and that is miasmatic totality. I told you it is very simple. You form the totality of the symptoms after evaluation. You can do it from Hahnemannian method or Kentian method or Boger-Bonihassen's method or Bonihassen's method. Ultimately, it is nothing but to individualize the case to the totality of the symptoms. And as you know, this totality of the symptoms may be of 2 components. There may be diagnostic totality and also the therapeutic totality. The diagnostic totality will help you to diagnose the disease, and in the background of the diagnosis of the disease, you need to individualize the case, and that is the therapeutic totality. So on the basis of that totality of symptoms, you need to consider the causative measure. That means you need to select a homeopathic medicine which can produce similar symptoms and also the similar miasm. That's why a medicine which covers both the totality of the symptoms and the miasm, that leads to miasmatic totality, and that prescription will ultimately help to cure. In case of single miasm, to find out the totality of the symptoms and causative miasm is not so difficult. But if it is due to mixed miasm, then our job will be to some extent difficult. If you have a clear-cut idea, then it will not be so much difficult. So what is that process? I will show you. In mixed miasmatic cases, only the symptoms of the dominant or active miasm needs to be considered to form the totality. Plus, the symptoms of the corresponding latent miasmatic symptoms. That leads to miasmatic totality at that particular time. Why I am talking at particular time? Because of prescription, this miasm, psoric miasm will be, symptoms of psoric miasm will be disappeared. Then will come either syphilis or psychosis. Then after removal of any one of them, the last one will come up. So one by one, you have to remove the layers of the disease depending upon the miasmatic background of the patient. So the formation of the totality of the symptoms on the basis of the dominant miasm is important. That I've told you, that you have to consider all those symptoms of the dominant miasms and also the symptoms of the latent miasm of that particular positive miasm. Now to select the medicine, in case in which the single miasm is the cause, I told you that is very simple. You consider the totality of the symptoms and the positive miasm. That helps to select the medicine. In mixed miasmatic cases, only the symptoms of the mixed or dominant miasm to be considered, then you have to select the medicine. So please keep in mind that whenever you are going to treat a case, a chronic case, you have to find out the causative miasm. To sum up the whole thing, if it is a single miasm, our job is not so much difficult, rather easy. But if it is a mixed miasmatic cases, then you have to find out the dominant or active miasm. Then you have to form the totality of the symptoms of the dominant miasm, considering the secondary manifestations as well as the symptoms of the latent miasm, which should be the basis of our homeopathic prescription. So if you can do it, you will be able to cure the case completely. So with this, I just go to the next step. But please keep in mind, you must have a clear-cut idea of all these 6 steps to be successful in homeopathic clinical practice, especially chronic diseases. Next time, switch over to some other aspects. You know, the repertory, the mental rubrics. Some mental rubrics are very difficult to differentiate from the other. It produces some confusion. To understand the real meaning of these rubrics, Dr. Ortega applied the concept of miasm in interpreting the meaning of the rubrics. It may be a new concept to you, but please go through the book of Dr. Ortega's book on chronic miasm. I'll give certain examples. The book is a very big one. You can consult that book. But how to apply the knowledge of miasm in interpreting the meaning of the rubrics? I have taken some rubrics for your convenience. The rubric, worry of life. Usually, the worry of life means feeling tired of or bored with life. The patient feels tired and bored with life. Dr. Ortega referred Dr. Kent's few lines. Just I read out. He had no complaints about life. At least no reason for complaint come to his mind. But he is just wary of it. Like someone who has taken a long walk and tired. His life may have been satisfactory, difficult, or happy, or even joyful. He is still weary, tired of it. That means there is no cause to feel tired or bored with life, but still the patient feels tired or bored with life. That is Sora. Here, I have shown that there is 3 blue lines and 1 red. Dr. Ortega signifies Sora by blue color, red color by syphilis. So, weary of life, predominantly 3 plus Sora and 1 plus syphilis. Another rubric, loathing of life. The literal meaning of loathing of life is a feeling of intense dislike or disgust, hatred. Here I also refer a few lines from Dr. Ortega that the patient has a different state of mind. He may not have lived long. He may be a beardless youth or even a baby, as in Antim Crowd, where we see totally manifested this loathing for life, lack of enthusiasm for it, aversion, or at least indifference to life. That is, no liking for it, but his life. Distinctly different symptom is thinking about death. Yes, another rubric, thinking about death. I will discuss afterwards. Now, here's the mathematic background. According to Ortega, 2 plus Sora, 2 plus syphilis. That means it is a combination of equally Sora and syphilis. Why syphilis? Because there is a self-destructive urge in case of loathing of life. That's why it is also syphilis. So you see that how this both worry of life and the loathing of life seems very similar. But applying the knowledge of miasm, we can understand the meaning of these rubrics so that you can apply in our clinical practice. Another rubrics, thinking about death. The patient, again I am referring Dr. Ortega's few lines, the patient may not feel worthy of life or conscious loathing for it. But when examining him, we find that he often thinks about death. There is simply thinking about death that is frequent and inevitable thoughts about death without any apparent cause. Here it is predominantly syphilitic, 3+, but less sorry, 1 blue. That means thinking about death is predominantly as syphilitic, only some tinge of sorrow. The desire for death is a purely syphilitic symptoms, but the patient manifests quite certainly the desire for die. He may enjoying life, he might not have lived very long, he may be happy, but nonetheless he desires death, and the patient commits suicide without any prior indication. Syphilitic patient all on a goes and do suicide. That is suicidal disposition, purely syphilitic. The intent to deprive oneself of life in one way or another by jumping out of a window, by poisoning, by hanging, cutting one's brain, etc. That suicidal disposition is purely syphilitic. The very close rubrics like irritability, anger, rage or fury. Irritability, psoric, anger, psychotic, rage or fury, syphilitic. Here he has given very good examples by which we can differentiate 3 rubrics. The first of all, irritability. Pathological irritability. Yes, we always consider irritability which is pathological, disease. Many times we express our irritation, but if it is pathological, it is beyond the not normal, that becomes a pathological irritability. Pathological irritability, not the kind which is fully justified by effective causes in a normal man. As you know, there is certain cause where person becomes irritable. That may be normal. But pathological irritability, if it is superficial and transient, the individual becomes annoyed, shows it, and it passes. By saying that it passes, we do not mean that it is of short duration. It may have pauses and continue, but it never attains a considerable degree. Please keep in mind that irritability, it's not so much destructive. The patient expresses some irritability against certain cases, and that type of irritability is sorry. But the same irritability leads to anger, which is psychotic. Anger means where the annoyance clearly manifests to others. Earlier, that irritability is just express something by talk or like that. But whenever he expresses it clearly to others, it becomes psychosis. Dr. Ortega given very good examples. I would like to refer his example here also by quoting his few lines. On the other hand, if the annoyance grows, the individual becomes exasperated. Exasperated means extremely annoyed, starts shouting, is obviously excited and manifests his displeasure intensively. Or, in a word, if he explodes, making his annoyance very obvious, is true irascibility, that is anger in the repertory, during which he may pound on the table with his fist, shout, get red in the face out of excitement, and maintain that climax of wrath in himself, as well as making it clearly manifest to others. This anger has been frankly your stint of psychosis. You see, when the irritability is very much expressed by shouting, by pounding on the table of his fist, becomes red, that means the severity of irritability expressed to others, that is psychosis and that is anger. But what about rage or fury? That is violent, uncontrollable anger. Whenever the patient becomes angry, the patient becomes violent, even shoots or beats certain person. When such a sudden and loud flare-up has an admixture of syphilis, it has appearance of violent and dangerous wrath. And whenever wrath is entirely and predominantly modified by syphilitic miasm, it produces the symptoms known as rage or fury. Whenever furious or anger, he throws the objects, blocks the different objects in the room, beats someone. That means that violent, uncontrollable anger, that denotes syphilis. So irritability, anger, rage and fury, the meaning is very close to each other, but that can be differentiated by the knowledge of our miasm. The rage or fury is the wrath which overwhelms the individuals and converts him into a predominantly destructive element while he is under the effect. That means anger leads to some destructive work, destructive attitude, that is rage or fury, that is syphilitic. This may not even very manifest, but keep deeply within, yet driving the individual to wound or kill or commit some other act of destructiveness. So yes, that is important. He may lead to different types of destructive works, and that is rage of fury. And the last, I will discuss about another three rubrics. Anxiety, which is purely historic. Fear, psychosis, and anguish, syphilis. Before discussing the differentiation proper, Dr. Ortega has given a very good example regarding the development of anxiety in the human body. He has given that whenever the child is within the mother's womb, there is no challenge to his life. He or she can take oxygen, maintaining the different life needs very easily from the mothers. But after the birth of the baby, he is exposed to different types of challenges. And that challenge in relation to its existence. He needs food. So he cries. He needs to excrete. So after the birth of the baby has to face the different challenges, and that challenges ultimately lead to different types of anxiety manifestations and what he called as existential anguish. That means anguish in relation to maintain his existence. I'm just read out few lines of Dr. Ortega. Anxiety is conceived as the outcome of man's first sensation after birth, when fetus abandons the maternal enclosures in which it lives with practically no effort. When it passes to the outside, and there must work steadily to exist, from oxygenating his blood to taking blood food, digesting it, secreting it, submitting himself to various movements, all this combined with aggressiveness of the external environment stamps on him a feeling of relative incapacity, which is translated into anxiety, precisely existential anguish. That I already told you. While our existential insecurity, what is insecurity? An insecurity which all feel because of the expectation of the death and possibility of harm from many elements around us, including our fellow human. It gives rise to fears. Fear of dark, in being alone, of ghosts or people of evil, that is psychosis. That means our existential insecurity leads to fear. Fear of different types. Fear of dark, of being alone, of ghosts, of people, of any evil, of disease. And that fear is psychotic. But when this existential anxiety grows within us, leading to destruction, it becomes anguish, and that becomes syphilitic. That means how it starts, the existential insecurity leads to fear, psychosis, and that existential anxiety leads to destructive works that become syphilitic. So by that we can differentiate the three: anxiety, eminently soric, fear, psychosis, anguish, syphilis. Likewise, Ortega also differentiated quick memory, soric, absent-minded, psychosis, forgetful, syphilis. So these are some of the examples from the book of Dr. Ortega, where we can clear our confusion regarding the close meaning of the different rubrics in our repertory so that we can apply this in our clinical practice. Now, this is one aspect that I have finished. The next one, that is very important to understand, the miasm, susceptibility, constitution, and pathology. Why it is important to know? That we can understand the differential pathological expressions in different susceptible constitution according to their miasmatic background, we can understand. That's why I want to discuss that aspect, that why pathology differs on the basis of the miasmatic influence in different susceptible constitution. That concept you must be very clear-cut. The susceptibility, according to homeopathy, is nothing but the general quality of all living organisms to receive a stimulus and to react accordingly. You know, very simple definition of susceptibility. Now, this reaction against a stimulus in a living organism may be normal. There is normal reaction, normal digestion, normal reproduction, normal functioning of the immunological system. So all type of physiological activities in our body are nothing but the reaction of our body against the different stimulus. So long their reaction is normal, the patient has normal susceptibility, and then that denotes the condition of health. But whenever that reaction becomes abnormal means if it is hypo or hyper, increased or decreased, increased above the normal, decreased below the normal, both are abnormal, and that denotes abnormal susceptibility, and that abnormal susceptibility denotes disease. Now, you see, the miasmatic influence soda, whenever it acts on a particular miasm, that leads to soric susceptibility. And that soric susceptibility leads to soric manifestations or soric disease. If it is psychosis, if the person is under psychosis, they lead to psychotic susceptibility, psychotic manifestation, psychotic disease. The same is that whenever the person is under syphilitic miasm, it leads to syphilitic susceptibility and syphilitic manifestations, leading to syphilitic disease. That means the human system, human organism, in the condition of health, maintain normal susceptibility. But that susceptibility is being delayed by the miasmatic influence, leading to abnormal susceptibility, either soric, syphilitic, or psychotic, or their different combinations. Just I have given the life force is under the power of another dynamic miasm. Pathognomonic symptoms of a given case covers the active miasm, that is the outer manifestation. The outer manifestation is but an inward expression of the inward process, and ultimately that is expressed through pathological expression. What we say in homeopathy, it is the internal dynamic derangement of the vital force, which leads to the manifestations of disease outwardly. So inwardly, there is internal dynamic derangement caused by the miasms. And that internal dynamic derangement ultimately manifested outwardly through different pathological expressions depending upon the miasms. And that's why the patient's manifestations differ according to the miasmatic background. Next, differential manifestations of diseases under miasmatic influence, including complications. In fact, at the very beginning, I discussed about the differential manifestations of the disease, manifestation of disease like diabetes mellitus under miasmatic influence. Not only that, we'll see the complications in relation to a particular disease differs person to person according to their miasmatic state. You will say that diabetes mellitus in a psoric patient, complications usually develops after long suffering. From the knowledge of practice of medicine, you know the different types of complications in relation to the diabetes mellitus, like diabetic nephropathy, diabetic neuropathy, diabetic other food complications, so many different types of complications. In fact, diabetes mellitus is a silent killer affecting almost all parts of the body in the long run. But you will see, in a patient having psoric background, the diabetic mellitus complications are very late to develop. Whereas a syphilitic diabetes mellitus in a syphilitic background, within 2, 3, 4, 5 years, they develop chronic kidney disease, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, because that syphilitic miasm being destructive in nature, that leads to early complications. The same is true in different diseases. I can also refer another disease like cancer. You will see a patient, psoric patient having cancer. He lives for a long time. A psoric patient in syphilitic background, with syphilitic background, died within 1 or 2 years. I've seen many cases. The cancer in a psoric state, in a psoric patient, lived long time without many complications. Psychotic also, but not severe like that of syphilis. They are less than psoric, but more than syphilitic. So, depending upon the miasmatic background, we can prognose the outcome of a disease. Please keep in mind, while having the knowledge of miasm, we can give a prognostic idea about the outcome of the disease, which is very essential in homeopathic clinical practice. Again, the concept of miasm and constitution, you must have a clear-cut idea that what is miasm and constitution. What is constitution? The simple definition It is the physical and mental makeup of an individual, including biological characteristics. The physical and mental makeup of an individual, including his biological characteristics. If you go through the concept of constitution, this is also a very big chapter. There may be different types of constitution in your medical field. Before Hahnemann also, I don't want to discuss that part. Just I would like to confine my discussion with Hahnemannian concept. It is better from homeopathy to consider three types of constitution. Soric constitution, developed under the influence of Sora. Psychotic constitution under psychotic miasm, and syphilitic constitution under the influence of syphilitic miasm. So each constitution, quite we differ or develop, is nothing but the expression of our miasm. I would also like to have a clear-cut idea about the meaning of individualistic, anti-miasmatic constitutional treatment. Please keep in mind, usually we say anti-miasmatic constitutional treatment. Sometimes even someone wants to differentiate anti-miasmatic and constitutional treatment. But if you follow the real concept, you'll see that there is no difference between anti-miasmatic and constitutional treatment. Please, what is anti-miasmatic treatment? To cure a disease, especially chronic one, permanently by homeopathic treatment, the medicine should not only be the most similar to the totality of the symptoms of the individual case, but it must also cover the miasmatic cause. From the very beginning, I repeatedly emphasize that the curative homeopathic treatment includes the consideration of the totality of the symptoms of the individual case, along with the miasmatic cause. This method or approach of homeopathic treatment is known as anti-miasmatic treatment. I think that is clear. Now this constitutional develops, I told you, the constitutional develops under miasmatic influence. Anti-miasmatic treatment on the basis of the totality of the symptoms covering the causative miasm denotes individualized constitutional treatment. That means anti-miasmatic treatment, whenever you're considering the whole totality of the symptoms and the causative miasm, that is individualized constitutional treatment. So, individualized anti-miasmatic constitutional treatment reflects the whole concept of homeopathic approach of curative treatment. So, there is no difference between constitutional treatment and anti-miasmatic treatment, because whenever you are not considering only constitution, we are considering whole things. So we are individualized. We are giving prescription on the basis of the totality of the symptoms, which denotes the constitutional expression of the symptoms. And that also reflects the miasmatic background of the patient. So we should not differentiate between these two. The real word that individualized anti-miasmatic constitutional treatment, that word equally can reflect the whole homeopathic curative treatment. So I think so far it is very clear to you. In fact, next day onwards I will discuss only the case study So far, I am giving you the details about the different aspects of the miasm. In the next class, I will discuss about whatever we have learned from theoretical aspects, how we can apply this, or how I apply it in the treatment of different cases with that theoretical background. Today, I will finish the theoretical part, but the last class, I will concentrate on discussing the actual cases which I treated on the basis of whatever I discussed in the last 3 classes. So today, this is the last aspects. Why miasmatic diagnosis is important. Please keep in mind, I have referred this from the book of the Dr. J.H. Allen and also Dr. Hahnemann. It gives us a very good idea that why we should think over miasmatic treatment. It is a common question of the students that why we are giving a medicine on the basis of totality of symptoms, on the basis of symptoms. So why there is need of miasmatic consideration? That particular misconception I would like to remove with this following discussion. Number 1, only symptomatically similar medicine palliates. Miasmatic similia can only cure permanently. So permanent cure is only possible by miasmatic prescription. In this regard, I would like to share few lines of Dr. J.H. Allen. The miasmatic similia, a remedy, may be selected whose provings cover the present phenomena of causative miasm, which would be, of course, more homeopathic. Indeed, it is the only thing that is homeopathic. Please keep in mind, the miasmatic similia can only be homeopathic. Number 2, selection of the most similar medicine is not possible without the knowledge of miasm. Again, Dr. J.H. Allen's few lines. We cannot select the most similar medicine possible unless we understand the phenomena of the acting and basic miasm. I repeat, to understand the phenomena of the acting and basic miasm. I told you there may be some acting and basic miasm, predominant miasm, all should be known. But the true similia is always based upon the existing basic miasm, whether we be conscious or unconscious of the fact. The curative remedy is the pathopoiesis. What is the meaning of pathopoiesis? The mode of production of disease, of a certain pathogenesis of existing miasm. As I told you, the different symptoms are nothing but the expression of the existing miasm. So, it helps to understand which miasm is acting, which is the basic miasm, which is the dominant miasm. Then only we can select the medicine. Third one, it is necessary to know the cause behind the totality of the symptoms. It is necessary to know the cause behind the totality of the symptoms. Dr. J.H. Allen, it is necessary to know what is beyond each set of phenomena. Not to know is ignorance. So you must know the cause behind the phenomena, behind the disease phenomena. Disease phenomena means not only the totality of symptoms. But the cause behind, without knowing that, it is nothing but ignorance. As I told you, it helps to understand the phenomena of disease development. Helps to understand the phenomena of disease development. Next, complete knowledge of disease refers to the knowledge of miasmatic phenomena. Yes, if you go through organelle, you'll see Hahnemann told the drug phenomena should be similar to the disease phenomena. So disease, behind the disease phenomena, you have to understand the miasmatic phenomena. And the miasmatic phenomena and disease phenomena, this completes the total knowledge of the disease. So that is completes the knowledge of disease. Next, anti-miasmatic prescribing dips deeper in the case, looking for prima causa morbi, and hence can only be cured permanently. That means the miasm is the primary cause of the disease, and anti-miasmatic treatment is essential to remove the primary cause to cure permanently. Next, without the knowledge of miasm, the physician cannot follow the evolution of the curative process. Yes, how the disease starts and the evolution of the curative process cannot be known without the knowledge of miasm. As for example, you have prescribed sulfur in a case on the basis of the symptoms of sulfur with the history of suppression of the disease, skin disease. After giving sulfur, there is appearance of different skin rashes. So if you go on again treating that rash, it will be illogical from homeopathic point of view. So why this disease has developed according to homeopathy? That present symptoms are nothing but develops after the suppression of the disease. So after the suppression of the disease, the present symptoms, you have given the medicine. So if the old symptoms reappear after giving the homeopathic medicine, you should not treat. So that curative process after giving a homeopathic medicine can only be known if you have the knowledge of soda. So until and unless you have miasmatic knowledge, you cannot understand the evolution of the curative process. Besides, therapeutic aid, the knowledge of miasm helps to prescribe proper diet and form a basis of occupation, mode of life, habit, so-called relations, sexual functions, etc. Here, GI challenge, go further, not only for the treatment, but also to prescribe the proper diet according to the miasm, to consider the occupation, mode of life, habits, so-called relations, sexual functions, keeping in mind the aggravation and amelioration factors in relation to miasm. The next, if you go through the aphorism 7 of Organon, symptoms represent the essence of the malady. What is the cause of the malady? It is the chronic miasm. Hence, you must know that cause. In aphorism 12, Hahnemann further states, it is the morbidly affected vital force alone that produces disease. What does Hahnemann mean by the dynamic influence of the morbific agent? He means that which causes all the morbid phenomena of disease to exist. He means sora, syphilis, and psychosis, and any intermingling or blending of the great triune. So that sora, syphilis, and psychosis, that causes the dynamic derangement of vital force. That is the dynamic influence of a morbific agent. It is this morbific dynamic influence which gives the organism and life force its own nature, its own abnormal sensations, emotions, mental and physical disturbances of all kinds and of every character which we call disease. I also already explained this concept through my earlier slides. But in aphorism 18, he says that besides the totality of the symptoms, nothing by any means be discovered in disease wherewith they could express their need and aid. In this relation, J.H. Allen writes, it is not an understanding of the totality that we are talking about, but an intelligent conception of the cause of the phenomena of totality. That is, the cause behind the totality that should be known by the physician. Totality grouping must be about the symptoms of the active miasm to cure mixed miasmatic cases. Yes, please, while treating a mixed miasmatic cases, you should not consider all the symptoms in a totality. Only the symptoms in relation to the particular dominant miasm should be considered. Otherwise, if you take all the symptoms and prescribe, you will not be able to cure. So that knowledge, the concept of the dominant miasm, that should be there. Understanding the order of the evolution of the miasm is essential to cure cases of the mixed miasms. Yes. How? You see, we take the history of the present complaints, how the disease has developed from beginning to the end. And that gives an idea about the evolution of the disease in relation to the different miasms. So that should be known for proper anti-miasmatic treatment. It is dangerous to prescribe deep-acting anti-miasmatic remedies in incurable cases. Yes. Suppose, from the knowledge you knew you are treating an incurable disease. If you give deep-acting anti-miasmatic treatment, there will be severe aggravation. So knowledge of miasm gives an idea that you should not give deep-acting called anti-miasmatic medicine whenever the patient is in incurable stage. Most of the homeopathic treatment, please, this is the last. Most of the homeopathic treatment today is palliative due to the lack of knowledge of the chronic miasm that lie behind the disease phenomenon. Most of the cases, we prescribe medicine which only palliates, only symptomatic similarity, no miasmatic similarity. No doubt that will give certain relief to the patient, but that will not cure. Dr. Hahnemann, in his book on chronic diseases, states a physician skilled in anti-miasmatic prescribing digs deeper into the case and applies an agent that has a deeper and closer relationship with the perverted life force. The results are always better. So Hahnemann also in his chronic diseases emphasized the need of anti-miasmatic treatment. And the last, the main who select similar medicine, but who are ignorant of the causes and effects, are not the true healers of the sick and have not the mind of the master. That is J.H. Allen. Now, so far I have discussed the importance, I emphasized that importance of miasmatic diagnosis. The last part, which is very important in your clinical practice, that during the ongoing anti-miasmatic treatment, many a times acute disease develops. How to tackle that situation? Very important. Usually you see chronic disease treatment takes a long time. While the patient is under your treatment, the patient may develop certain acute condition. How to deal such situation? I would like to give certain idea, because every time during the treatment of the chronic diseases, you have to face the same problem. That's why you need to have a clear-cut idea. During anti-miasmatic treatment, the patient may develop an acute disease. It may be an individual type or epidemic type or an sporadic type. So what will happen whenever an acute disease develops in a chronic patient? What is the physiological basis of explanation of intercurrent prescribing? Please keep in mind that of treatment is known as intercurrent prescribing. Intercurrent prescription, there are so many other aspects. That is a very big chapter to describe intercurrent prescription. Today, I will only restrict to my discussion regarding the intercurrent prescribing as described by Hahnemann during ongoing chronic treatment. What is the philosophical background? Just if you think of aphorism 36 of Organon of Medicine, whenever an acute disease develops in a chronic patient, the acute disease is, chronic disease are dissimilar, but the acute disease is stronger. So what will happen? It will suspend the weaker chronic disease. And now the acute disease will be, symptoms will be much predominant. And as you know, that acute disease has a specific duration of suffering. It leads to either death or recovery. So whenever the acute disease disappears, again, the chronic disease will reappear. So in an acute disease, when an acute disease starts in a chronic patient, the symptom picture changes because of interaction between two dissimilar diseases, the acute disease being stronger, the chronic disease being old and weaker. So now the patient suffers more on the acute complaints. Now, how to deal that situation? Hahnemann, in his book on chronic diseases, in the chapter of SORA, para 105, he has given very good examples, about 26 to 27 examples he has given, that how to deal such situation by acute intercurrent prescribing. Actually, I want to discuss one by one because all these examples are very important in our regular clinical practice. Just if the time permits, I will discuss the advice of Dr. Hahnemann in this regard. He has given some examples. Overloading the stomach. This may be remedied by hunger. That means by only taking a little thin soup instead of the meal and a little coffee. That means whenever there is overeating and the patient has certain discomfort, like certain indisposition, if you change the diet, the patient may overcome the situation. So this is a condition of indisposition. The second example, as given by Hahnemann, these are all examples given by Hahnemann. That's why, and it has very important implications in our daily clinical practice. That's why I'm reading to you before you. Disorder of the stomach from fatty meal by pulsatilla, fasting and pulsatil. A disorder of the stomach which causes rising from stomach after eating, and especially nausea and inclination to vomit, give anti-crude. Taking cold in the stomach by eating fruits, smelling by arsenic. Hahnemann advised olfaction as a route of administration of the medicine in such cases. Smelling of arsenicum album. Troubles from spiritual liquors, let's vomit. Disorders of the stomach with gastric fever, chilliness and cold, bryonia. Fright, when the medicine can be given at once, especially when the fright causes timidity. So acute fright which causes timidity, opium. If the medicine can only be given later, or when the vexation is joined with fright. So fright with vexation, aconite. Sadness caused by fright, ignatia. Vexation which causes anger, violence, heat, and irritation, chamomilla. Besides the vexation, if there is chilliness and coldness in the body, that is bryonia. Vexation with indignation, deep internal mortification, attended with throwing away what was held in the hand, staphysagria. Indignation with silent internal mortification, colosynthesis. You see how Hahnemann individualized. There may be indignation, but that can be associated with different types of symptoms, leading to different medicines. Unsuccessful love with white grief, ignatia. Unhappy love with jealousy, Alzheimer's. A severe cold by nux vomica. Diarrhea resulted from cold, dulcamara. A severe cold followed by pain, coffea cruda. A severe cold followed by fever and heat, aconite. A cold which is followed by suffocative fits, typical. Colds followed by pain and inclination to sleep, coffea cruda. Cold with consequent coryza and loss of the sense of smell and of taste, pulsatilla. Overlifting or strains, sometimes by arnica, but most certainly by Rastox. Contusions and wounds inflicted by blunt instruments, arnica. Burning of the skin by compression of water mixed with dilution of the highly potentized arsenicum amalgam. Here, Hahnemann advised some local application, that is compression of water mixed with dilution of the highly potentized arsenic, or uninterrupted application of hours of alcohol heated by means of very hot water. Weakness from loss of fluids and blood, China. Homesickness with redness of the cheeks, capsicum. Here, Hahnemann given some examples how to prescribe on the basis of the exciting factors or exciting causes, along with few other associated symptoms, to prescribe without disturbing your anti-miasmatic treatment. In this connection, I also mentioned that you can also think of, or you can take the help of relationship of medicines in this condition also. So relationship of medicine is another big chapter. Just I refer that sometimes we can think of considering the concept of relationship of medicines. So with this, this is all about the theoretical aspects of miasm. Please, it is not possible to give the each and every points. So far I have given you that it will give a good understanding of the chronic miasm, but you need to go through the original textbook. Actually, the original textbook, the Organon of Medicine, and the next one, the chronic diseases, their peculiar nature and their homeopathic cure. So understanding, it is very difficult. The language is very difficult to understand. That's why I wrote a book on this, understanding Dr. Hahnemann's the chronic diseases, their peculiar nature and their homeopathic cure, theoretical part. You can go for your proper understanding. And also next one, the third edition. Earlier that book was not there. The new edition has just published, which have a in-depth discussion on chronic miasm and homeopathic philosophy, where I have discussed individually Dr. Kent, Stuart Close, Roberts, Dunham, Hughes, and that gives us a very good idea about the homeopathic philosophy. You say that you need to have a clear-cut understanding of the homeopathic philosophy so that you can apply it in your clinical field with success. Now, with this, just for the meeting, I concludes my theoretical section of miasm. Let us, we can discuss if the time, there is some time, 5 to 10 minutes. So if you have any question, we can discuss that part. So any question if you have. So from my aspect, that is the end of my theoretical discussion on miasm. Hello.
Thank you so much, sir, for this valuable knowledge. If anyone is having any questions or doubts, they can ask. Sir.
So no question on. Hello.
Do anyone have any doubts? Kindly ask. So nobody is asking anything.
Okay. Okay. So okay.
Thank you, sir.
So I take the lead from all of you. Thank you all for your patience hearing. Thank you all. Okay.
Okay. Thank you, sir. Thank
Next,
you so much, sir.
next day I'll discuss only the cases. Okay. Thank
Okay,
you
sir.
all.
Thank you so much.
Thank you so much, sir.